The earlier the cancer is found and treatment begins, the better the chances are that treatment will be successful. Here to talk about the development of new cancer drugs is Dr. Timothy Tyler, Director of Pharmacy Services for the Comprehensive Cancer Center at Desert Regional Medical Center.
With cancer care specifically, we used to have radiation, surgery, and chemo. You cut it with a knife, it isn't coming back. You can't possibly get every micrometastatic cell, so that was always a problem. Radiation's been around for more than 100 years. Chemo started in the 50s, and the idea was we just poison the cancer, and hopefully we don't poison too much of the patient. That's a strong word, but really, we're trying to kill a cancer here. The thing that's sort of been a game changer for oncology, for cancer care, has been immunotherapy, using the body's own immune system against the bad guy, the cancer. So when we're dealing with immunotherapy, in the early 90s, we'd had 20 years of research sort of from the HIV and immunotherapy from that. And some of the spillovers started to come into cancer where we started to realize the immune system's a pretty important thing. And now we are getting many, many new drugs. We've reached the point where we have more than a handful of drugs that work with the body's own immune system to downregulate and target these cancer cells. And you don't lose your hair. You don't feel like you're going to be sick. We've got great supportive care drugs that help us anyway. But using immunotherapy, using your body's own immune system to help fight the cancer has been a game changer, a massive game changer. I think of drugs for, we have Yervoy for melanoma. This isn't chemotherapy. We've had no good drugs for chemotherapy for melanoma cancer. Now we've got a drug that can actually attack just via the immune system. You don't lose your hair, you don't get sick, you get 4 treatments, you're done. Is it a curative agent? Not always. It buys time. So again, we still haven't gotten to the point where we're curing cancer. I have a woman with breast cancer, 11 years with metastatic disease. 20 years ago when I started, that was insane. That was unheard of. We've now sort of taken some cancers and made them almost in the chronic disease. Yeah, I have diabetes, I have hypertension, I have cancer. Wouldn't that be great if the nasty stigma of cancer could be reduced to, yeah, I have to take this chronic medication. We're starting to see some of that. Some of these biologics, they're very expensive medications, but the trade-off is huge. We're actually getting people living longer. There's also a growth in oral cancer therapy. Traditionally, cancer therapy had meant 25 years ago, you were admitted to a hospital. Who wants to be in a hospital? And you're sick and you want to go home. The major change that happened about that time was outpatient care. So you go to an outpatient clinic, you get treated there, and then you go home and put your head on your own pillow at night. Patients did much better, they felt better, they were motivated. Now we're even to the point where instead of having to come into the clinic, we could prescribe a pill. Leukemia, that we had to give nasty drugs and the success rates were horrible, and now you just take a pill. You have to take it for the rest of your life. But it's one pill. It's a game changer. It's a massive game changer. And those things are exciting. Probably less pills, more genetic manipulation is probably the next step, where we give you something to fix the genes that went bad, and we're just changing your genetic makeup to the point where the cancer is written out of the script. It's no longer there.